Adults with thalassemia require a multidisciplinary approach, including regular monitoring of their transfusion regimes and suppression of the ineffective erythropoiesis, monitoring of their iron overload using surrogate markers such as the serum ferritin or the MRIs, for example, the R2 FerriScan MRI modality, quantifying the liver iron content, which we know represents precisely and accurately the total body iron stores, regular monitoring of their cardiac function, endocrine health, bone densities. My approach over the years has been that of a multidisciplinary one with dedicated expert clinicians from other specialties who would support me and my extended team in formulating management plans according to the patient characteristics and complications they accumulate as part of their disease. I work closely with clinicians such as hepatologists, cardiologists, endocrinologists, and psychologists, and others who are stakeholders of our hemoglobinopathy multidisciplinary team with a special interest in these disorders. And this makes a huge difference to the outcomes for a lot of different reasons. I see my patients in outpatient clinics for monitoring of all the above, 3 monthly mostly, but the frequency does very much depend on the characteristics of each individual patient, and it's very important here to highlight how we do comply. We have to adhere to national and international, as well as trust-specific, so where we work, specific guidelines and protocols. However, the treatment should be individualized according to each patient's characteristics from the medical side of things, but also from their own wishes and preferences as to how they want to be treated. But we have also dedicated specialist nurses, which is a key role embedded into the multidisciplinary approach in these patients in England, who oversee their treatment throughout and advise patients and act as great links between clinicians and the patients. Furthermore, myself and my team have a very strong interest for a long time now, for years, in both the novel treatments being looked at in clinical trials, as well as which includes curative treatments. And we have it dedicated to these patients, to both thalassemia and sickle cell patients, clinical research teams, which consist of clinicians and research nurses. And patients are approached about the different clinical trials going on in the outpatient clinics when they come for their regular monitoring, or when they are inpatients or hospitalized for an acute complication, but also during patient group meetings, which we try to schedule on a regular basis, where we hear from patients themselves any concerns or feedback they want to give to the team looking after them. But also here to say that the patient societies, so for example, the UK Thalassemia Society and the Sickle Cell Society in the UK, also play a huge role in increasing the awareness about research and novel treatments going on, and encourage patients to discuss eligibility of any of those treatments with their clinicians, whether that's in the context of clinical trials, or whether that's actually in the context of being eligible for applicability of those treatments to them. And recently, with the introduction of the gene editing in thalassemia as well as in sickle cell disease, we have formed strong relationships and collaborations with a team looking after or responsible for stem cell transplantation treatments at the center where I work. So close collaboration between the red cell hematology team as well as the bone marrow transplant team is needed here to not only confirm eligibility for these treatments, but also actually undertaking it